So good afternoon, everybody. I'd like to welcome you to this WHS session, Tobacco Control in Times of the COVID-19 Pandemic. My name is Hajo Kömer. I'm a pharmacologist by background, and I'm the CEO of Charité Academic Medical Center in Berlin. And together with Yael Zehuli, I'll chair this session with a variety of distinguished panelists. Within this panel, we will address two major challenges, which are of utmost importance to health and healthcare on the global, on the national, and at the personal level of our experience at Charité in Berlin. I think it's fair to say that for decades already, tobacco use is spreading worldwide. It's one of the leading known risk factors for morbidity, mortality from non-communicable diseases such as cancer, respiratory disease, and diabetes. And it's intertwined with the COVID-19 pandemic because this is really adding to the NCD burden, because patients with these conditions are more vulnerable for developing severe illness when they are affected by the COVID-19 virus. There's increasing evidence that smokers, when infected, are more likely to get worse symptoms. They're more likely to be hospitalized and to be admitted to the ICUs. According to WHO, Germany is still a high burden country regarding tobacco. We have about 16 million people currently smoking. 120,007 patients died in 2018 from the health effect of smoking and exposure to second-hand smoke. Severe COVID infection was the cause of over 90,000 deaths in Germany since the beginning of the pandemic. So in summary, the clinicians, policymakers, and tobacco control advocates are highly concerned about the combined health threat due to this coincidence of health risks. We are at the forefront in dealing with overcharged healthcare systems in Germany and worldwide, and this certainly adds to the problem. The World Health Summit, with the topics global challenge, global responsibility, and global networking, is from our point of view an ideal platform for discussing and finding solutions for these global health threats. And the idea is to build a bridge both on the science and the clinical side between tobacco control and control of COVID-19 pandemia. There's a clear common denominator, of course, for both diseases or for both noxes, which is that prevention works. And with that, I would like to hand over to Yael Zehuli, who is the co-chair, and he'll introduce how he sees tobacco and COVID-induced health threats from the perspective of women's health.
Thank you, Professor Kömer, and especially for your personal engagement to run from an acute institution to a preventive institution. And I'm a gynecologist, and I'm even a global health administrator for the Charité Global Health Center. And I'm a non-smoker, and I'm a gynecologist, and there's this clear link between tobacco in women and the occurrence of gynecological cancers, including cervical cancer, but even all the other diseases, what impact significant the quality of life and the outcome of women with gynecological malignancies. And we are always looking for a holistic way, and we know that between tobacco, even in breast cancer, there's a strong association, and that's the reason that COVID-19 has even a significant impact on the healthcare system by disrupting the access of women to medical interventions, including cervical cancer screening. And we know that we have a significantly higher incidence in advanced diseases and several gynecological diseases because we have these barriers. As a consequence, there's a huge backlog of care needs of women. And we know that women health, including the women health cancer issues, are a quality indicator for every healthcare system. And that can only be reduced step by step by the current capacities in every regional, but even cross-national and cross-cultural care system. And we are observing tremendous delays in the diagnosis, treatment and aftercare management. I'm looking so forward hearing and learning from our panelists from all over the world and to share their experiences, to look for crossover talks and new direction in our circumstances and strategies. And therefore, I like to hand over to Andreas Ulrich, who will introduce this outstanding panelists and introduce the 3 rounds of the statements in response to every individual question. Thank you.
Thank you very much, Khalid. I will now introduce our distinguished panelists around the globe. So we are reflecting, we are mirroring the global pandemic, the global tobacco pandemic with our panelists. And I will start with Noor Obeidat. Noor Obeidat is the director of the Cancer Control Office at the King Hussein Cancer Center in Amman, Jordan, and director of the Cancer Center Council for Tobacco Treatment and Training Program. She will report from her angle in the Middle East and how COVID has affected her tobacco control work. We will then hear from my friend and former colleague WHO, Rüdiger Krech from Geneva, Switzerland, Director of the Department of Health Promotion, heads the WHO work on risk factors such as tobacco. So he's here leading the WHO tobacco strategy. He will address COVID-19 and tobacco prevention and control as part of a broader WHO framework of building resilient society. Bronwyn King is from Australia. So she is already later in the day, and she's the founder of the Tobacco Free Finance Pledge, which develops partnerships with big finance corporation to counteract financial flows to the tobacco industry. So she brings in the angle of the finance as an instrument to counteract activities of the tobacco industry. And finally, my dear colleague Mark Paraskandola. He is from the National Cancer Institute in the US, of the National Institute of Health. He's the chief of the research and training branch at the Center of Global Health, where he leads a series of research grant initiatives and programs in global cancer research, which includes prevention and control. So tobacco is an important column in his work to do comprehensive cancer control, prevention and control. I would like now to hand over to the chair to introduce the first question. Please keep in mind that you have 5 minutes per question. Thank you very much for joining.
We'll try it then. And the Q1, which really interests us all, is how COVID-19 has affected tobacco control. What are the lessons learned from the pandemic to make the real comprehensive prevention everybody's business? And this is something we really think seriously about at Charité, because for my country, it's pretty clear that prevention never works. And the approaches have been different. There was no contemporary ways to introduce prevention. So we want to do it differently this time, and would like to discuss with you or get your expert opinions on the issue of tobacco control in COVID-19. And maybe Rüdiger Krech from WHO will start. We'll be happy.
Thank you very much, Professor Quim. Thanks, Andreas, for the kind introduction. Well, the tobacco industry is responsible for more than 8 million deaths annually worldwide, and has now framed itself, believe it or not, as part of the solution to the COVID-19 pandemic. We now know that the evidence strongly indicates that smokers are up to 50% more likely to suffer worse from COVID-19 disease. That means that smokers are more likely to have more severe symptoms, more likely to be hospitalized, more likely to be admitted into intensive care units, and require help with breathing and or ventilation. Ultimately, smokers are more likely to die from COVID-19 disease than someone who has never smoked. In addition, tobacco use causes heart disease, diabetes, lung conditions like chronic lung disease and cancers, and all these conditions make people more vulnerable to COVID-19. So the tobacco industry portraying itself as part of the solution to the COVID-19 pandemic is the epitome of hypocrite. It's like a landmine company making money from people losing their limbs and then selling them prosthetics. The tobacco industry has been exploiting the COVID-19 pandemic and the resulting health sector resource shortages to gain a stronger foothold in the policy corridors in many national governments, making huge donations of ventilators, face masks, and hand sanitizers with tobacco company logos, funding research on vaccines that are made from tobacco leaves, and funding research on the alleged protective effect of nicotine against the coronavirus. There are recorded instances of scientists with financial links to the tobacco industry publishing COVID-19 related research without declaring these tobacco industry links. Not surprisingly, in such cases, the research has tended to support the nicotine hypothesis that nicotine offers protection from COVID-19 infection. One such paper, first published without peer review, was later published by the European Respiratory Journal, only to be retracted in March 2021, when the journal became aware that 3 of the authors had failed to declare their links to the tobacco industry. While the scientific consensus is clear that smokers with COVID-19 have higher risk of severe disease and death, the publication of contradicting studies aims at raising doubts and questions among the public and gain media attention. This tactic is not new. Influencing the scientific debate as seen with COVID-19 is a historical tobacco industry strategy. A key aim in influencing science is the creation of doubt around a given topic, be it the dangers of secondhand smoke, addictiveness of nicotine, links to diseases, or newly arising public health issues. Calls that more research is needed prevent the timely implementation of regulation, draw out the debate, and confuse policymakers and the public. To clarify the scientific consensus about COVID-19 and tobacco, WHO published a question and answer, a Q&A, a scientific brief and information products for the public that were widely shared on social media. The COVID-19 pandemic has given the tobacco industry an opportunity to knock on the doors and offer immediate donations in exchange for favors down the road. COVID-19 related CSR activities come at a price, access to and influence over policymakers. For instance, in Indonesia, where the tobacco industry made donations and then asked the local government of Bali to roll back restrictions on outdoor tobacco advertising. Ultimately, citizens will pay a price for their governments accepting tobacco industry donations, more harm, death, and disease from tobacco products. If we have learned one thing about tobacco control in this pandemic, it is that public health policymaking must be 100% protected from the vested interests of tobacco industry. Full implementation of Article 5.3 of the WHO Framework Convention on Tobacco Control. The biggest lesson apart from tobacco control that we have learned is that the most recent epidemics have all been caused by decisions and processes outside of the health sector, from avian flu, swine flu, Ebola, to SARS-CoV-2. These epidemics have all had something to do with how we have driven forward urbanization, how we have increasingly restricted the distance between the animal world and us humans. This means that in order to protect health, the health sector needs to collaborate much more with other players. The COVID-19 pandemic has clearly revealed the dangers for the world if health is not considered in all policies. Moving forward, there is a need for resilient societies that are better able to address health risks stemming from decisions in non-health sectors. WHO strongly supports tobacco tax increases as a measure to make societies more resilient. Increasing tobacco taxes will greatly improve public health and save lives by preventing kids from starting to use tobacco products and encouraging current tobacco users quit. At the same time, it will raise national revenues to help fund public health initiatives and strengthen national health systems. A tobacco tax increase is a win-win-win solution. A health win that reduces tobacco use and saves lives, a financial win that reliably raises revenue, and a political win because polls consistently show that this policy is popular with voters. This is why in our Department of Health Promotion, we have one of the biggest teams of health economists at WHO that works closely with governments in our member states. And thank you.
Well, thank you a lot for this really clear statement. And I guess it will be supported by Bronwyn King in a similar direction.
Thank you so much. It's such a great pleasure to be here. It's late in the evening in Australia, so it's great that we're able to connect in this way. I'd love to echo a whole lot of Rüdiger's excellent commentary there, in that I think that COVID has really shown us that the tobacco industry hasn't changed, and it's as if the world suddenly shifted focus onto COVID, which is absolutely the right thing for us to do, but it almost took all of our time, all of our money, all of our resources. It's as if it was the only thing that the world was talking about, and not just amongst the health sector and scientists, but amongst the media, amongst the public. And it's really shown us that if you take your foot off the accelerator of tobacco control for just one moment, you can bet your bottom dollar that big tobacco is right there to sort of seize the opportunity in whatever way they can, in old ways, in new ways, in innovative ways, but you can be sure that they're going to jump right into that space. And I actually had on my list a whole lot of things that Rüdiger has mentioned in terms of, these horrific publicity stunts of donating ventilators and government interference and things like that. But just to add perhaps a few more, as the world went online, we saw tobacco companies absolutely jump in and go online. We have never seen social media used in such a disappointing way by the tobacco industry, influencers being paid to promote brands. TikTok was barely a thing before the pandemic began. TikTok's everywhere now, and suddenly you have influencers using tobacco company products and really reaching a new audience. And it's an audience that the public health community has yet to really learn how to connect with. I think in global health, we're just getting our heads around that, but it only took a moment for the tobacco industry to do it. Another one to mention in terms of tobacco companies trying to be part of the solution, you may have seen, and many audience members may have seen, just 3 months ago, Philip Morris International purchased Vectura. Now, Vectura was a UK-based company that makes inhalers and breathing medications that are used by people who suffer from emphysema and a whole load of other horrible respiratory diseases, many of which, in fact, most of which are caused by tobacco. And so, of course, this caused a great deal of upset, but to do it while the UK was undergoing such a profound disaster with COVID was, of course, a very inopportune time for the global health community and the public health community to spend much time on it. It also happened at the exact moment that everybody in the UK and Europe went on summer. They all went on their beautiful vacations, and then suddenly, people had to be recalled at this exact moment when they really needed a break from the pandemic. So unfortunately, that purchase did go through, and so now we have this very complex and difficult situation where, in fact, a big tobacco company now happens to own a major producer of medications that are used by people all around the world, or right here in Australia, we have Vectura products. So it's going to be interesting to see how that pans out. In terms of the lessons that we've learned, though, I just want to go a few really big high-level things that I think we've learned from COVID that will help us as we move forwards with tobacco. Number one that we've learned is that anything can be disrupted. Anything. COVID has taught us this clearly. Things that were once impossible became reality in a matter of hours. And I think that that should bring us hope in tobacco control, because there is no reason that we can't innovate and we can't think up new ideas. What was once set in stone is no longer set in stone. So we should really use that. I think everybody is also familiar now with the concept of layers of intervention. In COVID, we know we have to have vaccines, but that's not enough. We need masks, and that's not enough. We need social distancing and test, trace, isolate. We need a whole complement, a whole suite of tools. And in exactly the same way, there is no vaccine for tobacco, unfortunately, but we need a whole range of different strategies to really bring this huge problem under control. I think the other really interesting thing is aerosols and safe air and occupational health and safety and legal frameworks. Now, I know that we're just still grasping this concept that that obviously in tobacco, we understand that tobacco is in the air and you can smell secondhand smoke, and that's dangerous. In the same way, COVID is in the air. And we now need to focus on how do we get clean air? How do we make sure that when you go to work that you can breathe clean air in the same way? Smoking's not allowed inside. So what about COVID and COVID policies? In Australia, we're just starting to see carbon dioxide monitors monitoring air quality inside. It's happening all throughout the world, in theatres, in cinemas. And I think that this also is the opportunity for us to talk about clean air, because tobacco sort of is the ultimate product to get that conversation going, as COVID has. So let's jump in there and see if we can use that. There's also health literacy. I think it's been so impressive to see the public uplift when it comes to talking about really complex medical issues. I mean, I feel like I'm still learning every day when it comes to COVID, and I've got a 20, 30-year medical history behind me, but the public wants information. They want accurate information. They want to know who to trust. And unfortunately, we have seen that fake news can win at the end of the day if it is not balanced by really strong, trustworthy information. Other things that we've learned, global interconnectedness has never been more important. Absolutely, with COVID, we've had to come together and realise that we're all in this mess together, and we're all going to have to get out of it together. In the same way, we need to, learn from what we've done in tobacco control and uplift everybody's experience in every country. And I think also the one other thing that really has come to general understanding, not just in the medical community, but amongst the public, is how important preventative measures are. I think that prevention has always been sort of a very overlooked part of medicine. It's not well funded, it's not well talked, it's not well spoken about, but now we really understand that prevention is crucial, and investment in prevention saves not just lives, but a whole lot of money at the other end. Thank you.
Thank you a lot for this contribution. We'd now move to the US to Mark Paus-Candola regarding the clinical settings in the combined times of COVID-19 and tobacco.
Yes, thank you. So glad to be here, and I think our experience in the U.S. has certainly shared much with what the previous speakers have discussed. I guess I also wanted to share that the COVID pandemic has certainly had a negative impact, I think, on tobacco control efforts in the U.S. Unfortunately, that we have been able to measure. So, for example, we actually saw an increase in overall tobacco consumption for the first time in many years during 2020. And so while cigarette sales have been on a steady decline since 2015, in the first 10 months of 2020, we actually saw an increase in tobacco consumption for the first time in a number of years. We also have seen, so our National Youth Tobacco Survey has showed that kids are continuing to smoke flavored e-cigarettes, and we have not seen a drop during the pandemic. This, of course, was a trend that began before COVID, but I think it's concerning that it continues, that trend is continuing. And finally, also, we saw that there was a major drop in calls to our national quit line, 1-800-QUIT-NOW, which is kind of a key indicator of interest in tobacco cessation. So we saw a 27% drop in 2020. And in fact, the volume of calls that we got to that national quit line was the lowest we'd seen since 2007. So this is, I think this is all really kind of concerning news for addressing tobacco use. And I think, we've tried to understand what's the reason for these trends. I mean, I think it's not entirely clear, but there are some potential explanations we can offer. Certainly, people were experiencing increased stress during the pandemic because of impacts on work, family, their economic situation. People may have had a lack of access to their usual coping strategies, going to the gym, visiting family and friends, and because there were periods of lockdown, people weren't always able to do those things. And they may actually have used smoking as a coping mechanism for stress and anxiety. Also conflict at home can contribute also to continued smoking. People may have less access to school and workplace-based smoking cessation programs, during COVID, and loss of employment also in the US at least is tied to loss of access to health insurance oftentimes and health care. So that can also present a challenge for many people. And then of course we saw, health services diverted due to COVID, which obviously became a focus for our health departments, and that had a downstream effect of potentially scaling back smoking cessation resources. But so despite all the negative, I did want to highlight, I think there are some opportunities here, and I think as the previous speakers have highlighted, so we've learned some important lessons from COVID, as Bronwyn mentioned, and I think people may actually be more receptive to health messages now. Particularly messages around respiratory health, given all the sort of information people have been exposed to around COVID and respiratory health. Smoking, of course, appears to put people with COVID at greater risk for hospitalization and more serious outcomes. And there have been some studies now showing that current and former smokers have an increased risk of severe COVID-19. So I think this is a message, we can use to communicate to people around the benefits of smoking cessation. And at the same time, there's also been an increase in use of mobile health and telemedicine tools during the pandemic. We've all become used to talking to each other through Zoom and other mechanisms. And so I think this can really provide another avenue to intervene. And so there's already evidence, for example, that interactive text messaging programs can increase quitting attempts among smokers interested in quitting. There are now a range of apps and social media programs out there to promote cessation. And so I think continuing to sort of develop these innovative tools to reach people, wherever they are, even remotely, to help them and provide them the support to quit smoking is a really important opportunity to take advantage of. So anyway, that's sort of a brief overview of our experience in the US. But yeah, so I'll turn it back to our moderator.
Well, thank you for that. And I guess Noor Obidat will tell us whether the same issues apply as well to Jordan. And I think it will be in general an interesting discussion whether that's a worldwide unified phenomenon that people tend to increase their smoking habits as a side effect from COVID. So you want to comment on that from your side?
Thank you all again for having me and for these really valuable remarks. And certainly, I think from the perspective of Jordan, I can say there are similarities to what I've heard from everyone who's spoken today. And so just to give everyone a brief idea, Jordan currently ranks as one of the top countries in terms of smoking prevalence. Unfortunately, we're seeing globally rates of cigarette use decline, but in Jordan, we've seen an increase. And right now, the overall prevalence is 42%. And when you're looking at young male age groups, the prevalence of tobacco use is approximately 72%, which is a really high rate of tobacco use. And associated with that, as a low resource country, we also face the general challenge, even pre-COVID, of enforcing bans on smoking. We do have the right laws in place, but we just have problems enforcing it. And I say this because part of what's happened as a result of COVID has very much to do with smoking bans and our efforts to enforce those. So going back to the question, how has COVID impacted us? It's impacted us in both positive and negative ways, obviously, and as everyone has said. So let's start with the negative so that I can sort of end on a positive. In terms of the negative aspects, COVID has negatively impacted us in terms of the tobacco industry's image. I think Dr. Rudiger said this to start with, but most certainly the tobacco industry actually contributed to Jordan's public fund for COVID relief. And that was an unfortunate thing. And obviously the donation was accepted. There was a lot of misinformation going around, and it's disappointing to know that clinically, we know that the outcomes of smokers who have COVID are much worse than non-smokers who have it. But of course, the focus was on 1 or 2 studies with misinformation about the lower chance or risk of going or having COVID if you were a smoker. And that was a huge focus, unfortunately, in the country. And I think this goes back to our poor media practices and the fact that there's just not much focus on strengthening balanced media reporting in Jordan. The additional negative thing that we saw, we are not on top of timely data collection, but I can tell you anecdotally that a lot of people were using tobacco as a coping mechanism, and Dr. Mark mentioned that. During our lockdowns, we were seeing people panicking about whether or not they could get to their tobacco, just as much as they were panicking about getting bread and basic food staples. So definitely, I think COVID probably agitated the tobacco use problem that we already are facing a huge issue with. The interesting thing about our response to COVID is that going back to what Dr. Roning was saying about safe air and a safe environment, is that we used a public defense law that was activated or reactivated in response to COVID to enforce smoking bans that we weren't really enforcing well with our general public health law. And this was interesting. It was possibly good and possibly bad because it was tied to COVID, and COVID was everybody's business. It brought in a lot more perspective and a lot more noise to the discussion about the importance of smoking bans. And I think when you make tobacco control everybody's business and you don't have a really strong anti-tobacco advocacy platform, you risk a lot of pro-tobacco noise getting in there. And I think for now, this is what we've been facing. So I say that we're trying to enforce smoking bans in response to COVID, and it's been good, but when we tied it to the context of COVID, it feels like a lot of pro-tobacco noise got in there. And I think we're still facing this challenge now, where we've got a lot of small businesses demanding that smoking bans are not that rigid so that we can have our cafes open again. And just for perspective, smoking cafes, water pipe cafes are very a very big deal in Jordan. And a lot of small businesses claim that this is their only way to economically survive. And so it's brought in a lot of debate. And I think our lesson learned here is that if we don't invest in a strong anti-tobacco advocacy platform, when we make tobacco control everybody's business, it risks us derailing the entire topic. But switching from the negative to the positive, one of the strongest things, or one of the greatest things I think that's happened in response to COVID is that we finally realized that we can't keep telling people to stop smoking without really supplementing our resources for quitting. And so the Ministry of Health, and we supported the Ministry of Health in doing this, expanded their smoking cessation clinics. So there was a lot of additional training that needed to be done, and it was done. So we moved from 5 public smoking cessation clinics to approximately 26 public smoking cessation clinics in the past 8 months. And this was, of course, a joint effort between the Ministry of Health, the World Health Organization, and on our part, from King Hussein Cancer Center, we were training these physicians to establish smoking cessation services. And it feels like this recognition that we need to do more in terms of providing smoking cessation services was not just something that we saw in Jordan. We saw increased demand from our colleagues in Kuwait and our colleagues in Palestine, to say the least. So, so there's been more interest in availing smoking cessation services from that perspective. So I think from a positive perspective, this is something definitely we can say was a good thing to happen during the COVID response.
Well, thank you. And just out of interest, could you give us a very short glimpse on the COVID situation in Jordan?
So the COVID situation, interestingly, has been stable, not good, but stable. I think we went through 2 very alarming waves in 2020. One was in October 2020, and the other was in December to January 2020 to 2021. And these 2 waves were actually quite shocking because they caught us by surprise. You know, until October, we had a really rigid lockdown. We had locked down our airports. People weren't coming in and out of the country. And so we saw globally what was happening, but it really didn't hit us until once, you know, borders were open and things just escalated very rapidly in October. And it was a really tough period because we faced what everyone else in the world faced, and we were still surprised. There were a lot of deaths. There was a lot of mismanagement. There were a lot of, you know, unknowns about what's going on in hospitals. How are we managing situations? There was a lot of fear from healthcare practitioners' perspective. And it was just a lot of mayhem to begin with in the first wave. I think in the second wave, there was this learning curve that we reached. And so things were generally a little bit more controllable. Add to that around that time, more people were getting vaccinated. And I think with the increase in vaccination rates, things gradually stabilized. Even across the first half of 2021, things were generally stable. And I'm not sure what it is. I think it's the lower mortality rates that we're seeing, perhaps because of vaccines, but perhaps it's a learning curve altogether. But people aren't as shocked anymore to see the numbers. The numbers are there. They range between the late hundreds to early thousands on a daily basis of diagnosed patients, but the mortality rates are low. And we're not seeing the same sense of urgency that we saw in 2020.
Thank you a lot. I was just interested because it's currently our daily business to fight with that. And I would like to hand over to Yalit Sehuli to go into the next question.
Yes, so I'm really impressed by your experiences, and I think what Brownie and even you, Nora, already mentioned, that crosstalk is necessary, and we have to use this opportunity to learn how we communicate with patients. Brownie mentioned social media. Why not using medical staff as medfluencer and to use them as a channel to address preventive strategies? And that, I think, was even one of the reasons why we at Charité were proud to be part of the World Tobacco Day, what was really focusing on clinicians. And I think that can be one lesson we can learn what are our algorithms to communicate with patients, with the relatives, how to support good news and separate them from bad and fake news, and how we can use synergistic approaches to communicate sustainable from crisis to crisis, from prevention to prevention strategy beyond the diseases, because there's no doubt what you do for a pap smear or HPV detection without understanding the tobacco approach. So thank you very much. And let's move to the second round. Andreas?
Just hand over to Bronwyn King and start the second round of questions about how to engage stakeholders. Over to you.
Thank you again. So I think, this question really is around how can we engage stakeholders from various sectors to work collectively on a problem. And I have to say that this has been a subject very close to my heart for the past decade. So I'm a radiation oncologist by background, and I found out that, that my pension plan in Australia was investing my money in tobacco companies. Now, as you can imagine, as an oncologist, that was quite a shock to discover that, and it felt like a very bad fit for someone who really knew exactly what tobacco did to patients. And I had a very direct connection to not just the patients, but the families and the flow-on impacts of that devastation on the community. And so my whole life changed at that point. And instead of continuing more of a traditional career in medicine, I instead started and embarked on a career in sustainable finance. And so I spend my time now working with finance leaders. So these are leaders of big banks, big insurers, big pension plans all around the world. And I asked them to have a rethink about tobacco. Everyone knows tobacco is bad, but the finance sector up until very recently has really been left out of the conversation for tobacco control. And so I guess, with a brilliant team of great people in different parts of the world, including Her Royal Highness Princess Dina Mered of Jordan. So I just wanted a big shout out to Noor there to say that we have a great Jordanian connection and a great advocate in Princess Dina, who's been an amazing advocate for and champion for tobacco control for many, many years. But with that team, we have managed to, I guess, look at the finance sector as an opportunity to find a new lever, a new point and a novel way to enhance global efforts on tobacco control. The finance sector is enormous. It's very powerful, obviously. They've got a lot of money, and it's a sector that can make things happen or make things not happen. And we figure that it's much better that they're on our team, that they're lined up side by side with the world's health leaders, with governments, with parents, with teachers, with communities, with people all around the world who are trying to bring an end to tobacco. Now, 10 years ago, when I started this work, it was very, very difficult because at that time, really the finance sector just thought of tobacco companies like any other company. They thought of tobacco companies like investing in a car company or a bank or any food company, anything, clothing company. And they just sort of put them straight away in the same category. And so my team really had to think strategically around how can we get the finance sector to see that tobacco is different and tobacco requires a really unique and collective approach that might be different to anything that they're otherwise investing in or lending money to. And so we've sort of had to learn the art of this. We haven't quite mastered it perfectly, but we're making great progress. And some of those strategies that I would use today are that, number one, when you're reaching out to a different sector or different people, right now I would use COVID as a starting point, and we're doing that very effectively at the moment. Everybody has a story about COVID. Everybody wants COVID to end, and we're all in this together in that we just can't fix the problem one country or one sector or one person at a time. When you're reaching out to the business community or finance sector, we know that they're prioritising health because they've all had to rewrite their own health policies. They've had to rewrite their own occupational health and safety policy. They're putting in working from home allowances. They're changing the way they do sick pay. They're changing whether you have access to special leave. So we know that they are prioritising health. So let's jump into this moment and see if we can get tobacco on the agenda. Because if they're willing to act on one, maybe they'll act on the other. Now, there's different opinions around the world on whether you should draw attention to numbers of victims when it comes to COVID and tobacco. Some people feel very strongly one way or the other, and I respect all of those opinions, but I do think it can help show the magnitude of the issue of tobacco. So if we take COVID right now, since the whole beginning of COVID, there have been 4.96 million deaths. If you go back to the 1st of January 2020 and come to today, there's been an estimated 14.7 million tobacco-related deaths, almost exactly 3 times the number. And those number of deaths from tobacco are not caused by a virus that we've never heard of, that we're learning to understand, that continues to confuse us and to change and mutate. Those tobacco-related deaths are due to a handful of companies that are run by human beings. It's just a few companies that make those products that cause 14.7 million deaths. We also have to remember that 15% of those deaths are people who don't even use tobacco. That's secondhand tobacco smoke. So sometimes people want to say, oh, well, if smokers are smoking, they go with the choice argument or the choice narrative. We can immediately dispel that by saying since the start of the pandemic, tobacco has killed an estimated 2.2 million people who don't even use tobacco. So what a shocking sort of number to really keep thinking about. And when we use the word pandemic all the time now, so familiarly, we need to remember that tobacco is this slow motion pandemic. It's happening over decades, and it's going to have an impact well into the future on next generations to come. In finance specifically, we know that sustainable finance is the flavour of the month. Now, in different parts of the world, there's a different appetite for sustainable finance. But we do know, if you look at the US, 1 in every $3 is currently invested in a sustainable or responsible investment strategy. So that has very rapidly increased just over the past couple of years. Now, there's many really tricky sustainability issues out there. I always say tobacco is the easy one. It really is the easy issue. It's just so black or white compared to other issues like diversity or mining or alcohol or marijuana or the pharmaceutical sector or climate. But on that issue of climate, this has overwhelmed sustainable finance in the last few years. And at the moment, it's almost the only thing that people in sustainable finance are talking about. And here we are on the eve of COP26 in Glasgow. Everyone's talking about net zero and the environment. And so for us, it's strategically been very handy to talk about tobacco and the impact on the environment. And if we just look at a couple of things, the number one ocean plastic is in fact cigarette filters. Many people are shocked when they learn that. But if you want a healthy, clean planet, it cannot be full of cigarette filters in our waterways. Number two, if you think of deforestation, it's estimated that 5% of all deforestation globally is due to tobacco production. Now remember, tobacco doesn't serve any purpose at all. That land should be used for either keeping forests, or if it's good, useful land, it needs to be used for food, to guarantee food security for vulnerable populations. And then if we look at one more metric, everybody's talking about carbon footprints. If we take the carbon footprint of big tobacco, it's more than entire countries. So for example, it's more than Peru, it's more than Israel, and that's just a handful of companies. So there's just a few ideas. I can see I've hit my 5-minute mark, so I'm going to stop now. But just to say that in sustainable finance, we've really focused on the environmental links of late, and that has been really a very effective way to get their attention when they're so busy focused on net zero.
Thank you so much. And I would like to hand over now to Mark and to bring back our perspective of the clinical setting, cancer center, cancer patient coming, still smoking. What can we do? What can healthcare providers do to use the situation? And they look, we are tobacco advocates. Over to you.
Yeah, so thank you. So yeah, I think obviously health professionals and health systems have a really critical role here in tobacco cessation and also effective communication of health information. So, and I think it's really more critical than ever now that health professionals talk with patients about smoking and offer assistance. And, you know, we can, I think, use the COVID as a learning opportunity as well. So in our, you know, at NCI, we run a website called smokefree.gov, which provides a lot of tobacco cessation information and resources, both for smokers, their family members, and also health professionals. And so we've been trying to put out some messages to help, you know, both smokers and also health professionals in, you know, making a decision to quit and sort of to give them tips for quitting, especially during the pandemic, dealing with stress. And, you know, I think the message we've tried to reinforce is that, you know, acknowledging that quitting is difficult. It's not easy for most people. And it may be especially difficult during this time, but it's really, we want to reinforce the message that it's always a good time to quit. And even if you have slipped or returned to smoking, you know, you know, you can continue to sort of recommit to living without cigarettes, and you know, acknowledging that for many people it may take multiple tries to get there. And you know, I think another point that's you know, I wanted to make here is that there's been a lot of misinformation, of course, during the pandemic, as we've seen. So we've seen the impact of misinformation around mask wearing, around vaccination during COVID, and you know, sort of getting out accurate, you know, evidence-based information to the public. You know, has been, you know, is an ongoing challenge around the pandemic. And you know, early on, and I think, you know, Noor had already mentioned this, you know, headlines, there were some headlines that suggested smokers might be at lower risk for COVID infection. These were actually based on really flawed statistical analyses, but got a lot of attention in the news at the time. And so health professionals really have a critical role in providing accurate information and evidence-based advice to kind of counter the misinformation that's out there. So we actually, there was a study done in the US that looked at the relationship between, you know, sort of perceived risk from COVID and quitting smoking behavior, which found that people that saw themselves at increased risk for COVID were actually more likely to make a quit attempt. And so that suggests that, you know, having an awareness of an appreciation of the risks of COVID can actually be associated with positive health behaviors. We've also seen, of course, the pandemic has also early on led to declines in cancer screening behavior. And so I think this is another impact to be concerned about. We found that, you know, in the early months of the pandemic, decrease in screening for breast, colorectal, and prostate cancers. That has partially recovered now, but you know, the impact of that is that we may see increased mortality later on as a result of later detection of cancers. So the COVID pandemic has disrupted, you know, I think some of our normal procedures and systems for cancer prevention and control. And then, you know, finally, I would just mention, I think there is an opportunity to make the economic argument here too. So we've seen that tobacco cessation interventions and tobacco control measures in general are highly cost effective. Increasing tobacco taxes is one of the most effective ways to decrease smoking prevalence. And we've seen this demonstrated now in many countries around the world over and over again. And so I think there's now a wealth of data that can be used to show the cost effectiveness of tobacco control measures to sort of persuade those in the finance, finance ministers and others of the benefits of tobacco control measures. Thank you.
I would like to hand over to Noor Obeid, another clinical perspective in the Middle East, in Jordan. How do you communicate with cancer patients who are coming in and continue to smoke when they are treated?
I'll start by saying that things haven't really changed over the past 2 years, because in KHCC, we've been trying to focus on this for several years. And what started off as a small smoking cessation clinic, and the option of coming to visit the clinic has progressed in the past approximately 4 years to become a mandatory issue for cancer patients. And so, in the past, it used to be, the patient comes in to their first cancer screening appointment, they're asked about their lifestyle factors, they're advised about their smoking, and then, if they're compliant, they will go to the smoking cessation clinic. If their oncologist really feels strongly about it, he or she will refer them to the clinic. And in between, that's a lot of ifs, and based on the studies we've had in our center, particularly 6 to 7 years ago when this was still an option, not a lot of clinicians were really being adamant about referring cancer patients to the smoking cessation clinic. But what finally became clear is that we needed a stronger entry point. And that entry point was our international accreditation that we apply for every 2 years. And one of the accreditation criteria is that the hospital needs to be seriously engaged in non-treatment or non-cancer treatment related activities that promote wellness and healthy lifestyles in cancer patients. And this was a great opportunity. And it was then, there was just a general consensus that, okay, let's pursue this more aggressively. And so for the past approximately 4 years, we've made this an institutional service that needs to be provided for all cancer patients who come in. So they come in, they have to visit the clinic. In that first visit, a lot of information is shared with patients so that they better understand why smoking, even after a cancer diagnosis, is a huge issue. And this has dramatically improved the rates at which we see patients. But to be realistic, it's not the final solution, because once you get that patient 1 time or 2 times, you also need to get the patient back in multiple times to see them through the journey of smoking cessation. And we lose patients. I mean, this is the reality of smoking cessation. You lose cancer patients along the way because they're either not ready or they quit temporarily. We see this a lot. They're able to quit when they're on chemo or when they're going through really aggressive radiation sessions, but their intention is eventually to go back to smoking. And so they quit temporarily and they don't have the intention of coming back to the clinic to visit. So there are caveats. There's always, that reality of, yes, we've institutionalized it, but no, it's not the perfect solution. And we need more aggressive interventions when it comes to following up patients. And, I can think of a lot of things that we can do in the center to make this a stronger case for cancer patients, and to make it more relevant, because understandably they come in with so many other issues, and the last thing they want to deal with is something that's not in their minds directly related to what they're facing now in the oncology setting. So having said that, this is what we're doing from a clinical perspective in terms of our cancer patients. There's still a lot of room for improvement. And I think as we learn more about how patients learn and understand and communicate, I think our methods of reaching out to patients can improve as well.
Just a quick additional question to you, Noor. What do you think about the system, care system for COVID, severe and less severe? Do you think there's an opportunity to introduce smoking cessation to that angle from aftercare to COVID? Is this an opportunity? Is it already ongoing?
It's absolutely an opportunity, but I would not be able to say this from the perspective of a cancer center because we're not seeing COVID patients. So right now what's happening in Jordan is that COVID patients are seen in COVID specialized hospitals. But the opportunity is definitely there within COVID hospitals. So basically what we did in KHCC is very much replicable if you just took that and you used it in COVID settings. I think the commonality that everyone always says is, do COVID hospitals in Jordan have those resources to start integrating smoking cessation within their COVID services when they're probably already overwhelmed, you know? I think this is our biggest challenge when it comes to integrating or trying to integrate smoking cessation in ongoing clinical settings.
Thank you very much. And now I hand over to Rüdiger. Rüdiger, how do you see a perspective? You are interacting with governments. Do you think with all this COVID mainstream, where is the opportunity to interact with governments to say, look, don't forget tobacco control? How do you engage governments? Over to you.
Yeah, thank you, Andreas. First of all, to just support what Bronwyn was saying about investments and disinvestments in pension funds, so where they invest in tobacco. Just to say, first of all, there's a legal aspect. For those countries who are party of the Framework Convention on Tobacco Control, it will be, or it is, illegal to invest in public pension funds from the state into tobacco. A lot of countries perhaps don't know, but it's hard law. And that is perhaps something we need to address in the future. The same is true for reserves in health insurance, in sickness funds, where we know many sickness funds are legally bound to have about 3 months of expenditure in reserves. And many of the sickness funds do invest in tobacco, believe it or not. And that's, if they are public health sickness funds, that's also illegal. So for all of people who listen in today and are in government, I would just strongly advise to review whether or not public funds are investing in tobacco, and if so, they need to disinvest immediately. So that's just to support what Bronwyn was saying. Also to be clear that there's some legal obligations. But then how do we work with countries? And in health promotion, we have seen for a long time that it is not enough to say that health needs to collaborate with other sectors. It is important to understand and assess the agendas of the other players. We then need an adequate process to keep other stakeholders engaged, and for that, they need to see an added value in implementing projects in the health sector. So it is really that important that we the sectors we work with see the added value in collaborating with us. We know this for 30 years. If that is not done, intersectoral collaboration is not actually working very well. So, but let me give you an example of a current, quite successful, I must say, cross-sectoral project we are conducting in Kenya. So we as the WHO have partnered with the Food and Agriculture Organization, the FAO, and the World Food Programme to provide tobacco farmers with economically viable alternatives as a way to prevent possible adverse social and economic impacts. Because their livelihoods depend on tobacco production. The aim of the project is to use the collective purchasing power within the UN system and create an enabling and supportive crop production and marketing ecosystem that will incentivize farmers to move away from tobacco growing. This project will establish a new framework for procurement within the current UN system, which prioritizes access to the purchasing market for farmers who have switched from growing tobacco to alternative crops. The project will also feed into a longer term and wider effort to provide alternative livelihoods to farmers and workers involved in tobacco production. So the project was first launched in Migori County in Kenya in August, and will help at the moment 400 farmers to switch to an economically viable alternative value chain by the end of 2021. And I'm saying that because what we wanted to see is the proof of concept. So if we actually follow the added value to the different organizations, and if we're able then to make this work, then we can do it and replicate this in all other countries with WFP and with the FAO. Let me give you a second example, and Jalit, you alluded to it. This year's World No Tobacco Day has become a World No Tobacco Year. And we're engaging in a huge cessation program. We've identified 22 focus countries, but then also work with many, many other governments. And within those governments, between different sectors of government, the educational sector, the social sector, with private industry, to actually promote cessation campaigns. And we all know that it's not good enough to just give good information, but we need to actually have a multi-layer approach to cessation. And the aim is to reach 100 million smokers that will make a serious attempt to stop smoking. And we want to reach 7 million people to then successfully really having stopped smoking by the end of this year. We're in the midst of it still, but we're very, the feedback we receive from countries, including, by the way, from Germany, are very promising. We at the moment, we believe that it's quite realistic to reach these 100 million smokers to stop smoking. And if that was the case from all our evidence and our estimates, this could potentially lead to saving 3 million lives just for this, with this campaign. And again, as we see the added values of the different sectors coming together in this cessation campaign, that is when then those campaigns can be successful. So amongst all these bad news that we've seen, there are some actually good news. And Mark, you actually were referring to increasing numbers of increased consumption. You were not talking about numbers of smokers, but increased consumption during the pandemic. We will actually issue our trends reports in November in 2021. We do this every 2 years to see what are the major trends in tobacco control in this multi-layer multi-layer approach that we are taking with what we call Empower. So with monitoring, with policies, with increasing taxes, with not smoking public places, with not selling to children, and so on and so forth. So this multi-layer approach. And we have seen in 2019 that the overall number of tobacco smokers was plateauing, and we had forecasted a 2 million decrease of smokers, despite the overall population growth that we see. But despite that, we actually had forecasted a 2 million smoker less, so actually turning really the tide. And while we are issuing the report only in November, and I want to make you excited about this, but there's good news that we will come back with in regards to the overall smokers, and so the trend continues. And if we are standing together in the health sector, so that we have more health professionals advocating for tobacco control, we can turn this tide and really address this tobacco pandemic very, very well. So with this, back over to you, Andreas.
Thank you so much, Rüdiger. And I realize we have the privilege, we are the first to have the first information about a report which has not been published. So it's really something very exclusive offer from WHO to World Health Summit. Thank you very much, Rüdiger. And it hence, and what you have introduced, this intersectoral principle, which is a WHO basic principle, leads us to the last questions, which I hope we are getting into a discussion among us and the audience. How to develop intersectoral partnerships. We are still thinking in our business, in our silos, how we can communicate across that silos and help Rüdiger to achieve 100 million smokers to quit. So how can we help Rüdiger? Over to Bronwyn. You want to help Rüdiger. How do you want to do that?
We do. I definitely want to help Rüdiger, and I think we all need to be inspired to do our little bit, because if that's what you just said, Rüdiger, 3 million lives, is it worth it? Absolutely. So let's all get on board and let's all think really creatively. I mean, tobacco-free portfolios and the work I've done for the last 10 years has taught me an awful lot of things. Number one is to go global. Global challenges are very, very difficult. And so we need to really reach out and use our networks as much as we can. And I think that we really need to learn from each other all the time, because nobody does everything right. And but we all probably do some things right. So let's share the things that we're doing really well, but also let's be honest and share the things where we've made mistakes and where we wish we had have done something different, because I think that the challenge of tobacco is so significant, it's so deep, it's so big, but it will help if we can all stay connected and keep those lines of communication open. I think that we definitely need to be open to innovation. So let's get together and brainstorm and create and refine and work through new ideas. And I think we do need to bring young people into this, make sure that we've got diverse audiences representing everybody on the planet, so that we can get the very, very best ideas out there. We clearly haven't got them all, because if we had all of the good ideas, we would have solved the problem. So we know there are great ideas out there, but we have to be open to hearing when people come up with what might sound like crazy solutions. But at first, a lot of things sound crazy, and then in fact, we end up realizing that they're in fact genius ideas. We just didn't think them up ourselves. My third message is to use your voice. So if we're all going to help Rüdiger here, I think anybody who has a platform needs to step up to that platform and use it for all it's worth. If you have access to people who have a lot of influence, use those precious opportunities to put tobacco as an issue in front of them, so that we can make change together. And if there are any young people out there listening today, I always say to people, you don't actually need a huge crowd, and you don't need a massive following. You don't need 1 million likes on Facebook or TikTok or Twitter to make a difference. You really don't. You don't even need to have a title like CEO or to be someone in philanthropy or someone traveling the globe. All you need to do is want to participate. If you have ideas, if you have energy, if you have passion, if you have stories to tell, because the world does need to hear you. So use your voice and use the platform. When it comes to tobacco, we need everybody who is influential to push back against the ridiculous narrative that the tobacco industry is trying to push at the moment. Rudiger said early on that they're trying to pretend that they're part of the solution. They just try to do this all over the world. And in my view, it's the worst form of fake news that there is. So again, if you have a platform, please use it to explain that while the tobacco industry might say one thing on one hand, what they do on the other hand is continue to sell products that kill 8 million people every year. And we just need to really push back against that false idea that they're somehow the good guys in this. I also recommend that we absolutely try to keep people at the center of all of our conversations. Sometimes we can get lost in the statistics. I always tell people I just can't believe that I went to the largest UK pension plan conference a couple of years ago, and I was walking around at the lunchtime and I found a booklet that had a financial report on tobacco companies. And I thought, wow, this is good. I'm going to pick this up and have a read. It was 53 pages long and it had 0 mentions of the word death. It just talked about the finances of tobacco companies. Now, that really shows how important it is for the health sector to be engaged in all aspects of tobacco, not just the ones that we see right in front of our eyes. We're also a bit stuck in our own zone as well. And so we need to get out. And then finally, I think I'd just like to say that we really need to understand that change doesn't just happen. We've got to get out there and push things forwards to make it happen. And the good news is that when it comes to finance, there's now $12 trillion signed up to the tobacco-free finance pledge. 12 trillion US. A few years ago, it was almost nothing. Now it's 12 trillion. So we do know great teams, even if they're small, can make things happen. So thank you so much for having me this evening.
Can I ask you something? Maybe if you really want to go down to the roots of the problem, one day you would have to argue about simply taking out tobacco as a legal product. Have there been serious attempts in countries to do that? Because I mean, at the end of the day, we've seen that it doesn't work with alcohol. There have been several attempts to do that in various countries. Have there been such attempts in any countries you know of?
I suspect Rudiger would be best placed to answer that. Am I right, Rudiger? You're just on mute still.
Yeah. So I just see that. Yeah. So as you just said, there's experiences from alcohol and where we have seen that it doesn't work. What we have is the Framework Convention on Tobacco Control. And that is a hard law that's legally binding. And if we get the full implementation of the FCTC, I think that would be a very good step forward. Before then you would consider making it illegal overall. The point is you need to have very tough regulations on tobacco as such, and to also expand it to what we call these novel products of e-cigarettes and vaping and all that, which is actually another tactics of the tobacco company to actually recruit our children, 8 years sometimes of age, because there's no age limit at what time you can consume it. So tough regulations, high taxes, all that works. Empower, as we have it, our strategy works.
Mark, have you looked at your pension fund already, and who is investing and which companies are in your pension fund investment?
Yeah, well, I certainly will now. Yeah, so yeah, I mean, obviously that's important, I think, for all of us to be aware of, especially working in the health sector. So, I just wanted to say, I think, you know, we have a lot of experience now with tobacco control from many countries around the world. The Framework Convention has been in place for over 10 years now. And I think that means we have a lot of evidence and experience to draw on. And I think one important lesson is that we found that really a comprehensive approach is the most effective for addressing tobacco use. So, you know, this means if we put in place, say, a restriction on smoking, in public places, we should also at the same time be offering people assistance and help to quit. And I would just say I think it's really not just up to governments. There are a lot of things other organizations and institutions can do to promote tobacco control. So in the US, we've seen a number of university campuses, for example, go smoke-free, restricting smoking not only in buildings, but across the entire campus area, and then accompanied by sort of health promotion activities. And we've seen a number of large companies do this as well, and go smoke-free, so that they implement a smoke-free workplace policy in their work sites. They support smoking cessation. They provide coverage for smoking cessation counseling and employee incentives to stop smoking, and perhaps other wellness activities to take a sort of more holistic approach. So I think there are a lot of things that organizations can do as well to promote tobacco control. And then finally, I would just mention it. So at NCI, we've also been supporting research on kind of innovative ways to integrate smoking cessation into health systems where it may not have been a priority before. And I think this is another way to expand sort of the impact of tobacco cessation. And there are two examples of this at NCI. So we have a portfolio of research focused on promoting tobacco cessation among people living with HIV. We know people with HIV are more likely to smoke and also suffer the consequences of smoking, but they also have more challenges often in quitting. So we have been supporting research to develop, evidence-based smoking cessation interventions targeted at people living with HIV. And then we have another initiative that has been supporting smoking cessation interventions during lung screening and lung examination in the clinic. And so again, this is, it's important to get to reach people who are particularly at increased risk, who are smoking at increased risk of lung cancer and other lung disease, and to be able to intervene there, and to also get the message across that, it's never too late to quit smoking. It's the benefits of smoking cessation, even after years of smoking, are still there. So those are just two examples of, I think, innovative ways in which we can kind of expand our smoking cessation efforts into healthcare more comprehensively.
Thank you so much, Mark. Noor, when you think about what's happening in terms of civil society as a partner in Jordan, do you see a strong support from advocates from other angles, like cancer NGOs or NGOs fighting for civil rights? Do you see an opportunity to partner on tobacco control? Over to you.
So I'll make this very quick. And my answer is going to also reiterate a lot of what's been said and what Dr. Brunman said. Do I see a lot of current advocates? No. Do I see the opportunity and potential? Absolutely. I think we underestimate the science of advocacy. I think we don't do enough to really treat it like this is a tangible solution, and it's part of what we need to be doing right now. We really need to be focused on training people to become stronger advocates. And just to underscore what Dr. Brunman said, we need more people, we need younger people, we need different perspectives, because tobacco control, there's barely any aspect of the SDGs that it doesn't touch on. And there's so many different ways to reframe tobacco control to make it relevant to other entities, other people, and it doesn't have to be about health all the time. So do I see opportunity? Yes. Do I see potential? Yes, but it needs a lot of work, because oftentimes the last thing we think of doing is really putting things aside and focusing on how to train different people to become sustainable partners and advocates in tobacco control. And I will also mention one thing. I don't want to go over my time, but I did want to mention something about sustainable finance in a way, indirectly. One of our biggest challenges as a low resource country is that it's very challenging to go to the Ministry of Finance and expect them to jump on board with tobacco control, because obviously, you know, the first thing to be said is, you know, the tobacco industry is obviously the direct source of income, so to speak, for ministries. And I think the only solution to this for the moment, because unfortunately the argument of long-term savings and health and life save, it doesn't always appeal to financial entities. And so for me, I would love to see on a global level, on an international level, more pressure from donors, more pressure from international organizations that usually tend to work with ministries of finance, ministries of planning, more pressure to ask these ministries to be more responsible about the investments they make and the money they accept, because it's not working when we talk about it on a local level. Obviously, these are ministries that are interested in maintaining global ties. They're interested in their image. And so I think adding that pressure from global entities would be a game changer for us.
Thank you very much. I would like to give the floor now to the chairs, some reflections about what you have learned. Jalit, you were very, very attentive to say, I want to learn. What did you learn about this fantastic 3 sessions from your angle, women health, tobacco, COVID? Over to you.
Yes, so thank you all to the panelists. And again, it's really wonderful that we have first, I think, a commitment. I think that's very clear from the different perspectives and responsibilities. Second is that we even define initiatives, what we can, and even the people on the street and our staff can understand. So I love it to make a strict goal, how many people you want to reach and how we can really bring in a better health status, and then even to learn by maybe using biological, but even artificial intelligence to be much better in our targeting of our initiatives. And the second topic is, I think we need, as a clinician, we need to bridge to overcome the requirement from acute treatment to secondary and tertiary prevention. Therefore, we need other environments. I think it would be nice if I do surgery on a radical hysterectomy with nerve sparing, that even I was supported by the administration or from the healthcare service, that I even run into secondary and tertiary prevention. Therefore, we need, I think, country by country, different financial substitution systems. So this will be my personal wish. And again, I learned so much and I've been inspired, but now I'm much more inspired and motivated. Thank you.
Okay, then I would try to take the final sentence in the 2 minutes we have. I think if you look at the entire thing from a theoretical point of view, it's a rare situation in medicine because the problem we have is very clear and the solution as well is very clear. Stop smoking. This is an unusual situation in medicine because either of the one usually is not as fast available. However, we had a very interesting 90 minutes to discuss this rare situation, and you as expert offered different ways out or different ways of solution, first of which would be reducing accessibility, be it by information or be it by pricing, just making it more difficult in any way to get to the opportunity of smoking. There have been multiple discussions which I found very interesting to offer or to introduce these kind of restrictions on the economic level, because as the entire thing is purely economically driven, it's probably one of the key issues in the entire solution thing. And One thing we might put more emphasis on is to positively offer to possibly offer or access ex-smokers in terms of dealing with them, that either a late stop of smoking is a large preventive measure. And I sometimes have the impression that there is not enough information around about this particular topic. So I guess we stop now. Thank to all of you. It was an outstandingly interesting discussion. It was kind of characterized by multiple backgrounds, multiple nationalities on this board. So it was really worthwhile spending this time here. So thank you. Have a nice day for all of you.
And thanks special to Andreas Ulrich, who gave us his huge experiences, even to our clinicians, and even to bring this moderation to the World Health Summit for us. Thank you very much personally for your preparation. Thank you.
Indeed, thanks, Andrea, for bringing us together. Thanks a lot.
Thank you.
Thank you.
Thank you.